it does more than just the weight loss. But again, this medication is a smart medication because it does hit all those receptors. But all the way it can really be smart is by you adjusting to those outcomes. Like you're not craving things as much, or you not wanting to stress eat or however. So you have to get online with it. Yeah. Otherwise it's not going to work. But it is a smart medication, but it's not a magic bullet.
Yeah.
Because you have to do the work.
You know, a lot of people are coming out and saying that GLPs are the lazy way to get things done. And I think that's very offensive because it is a tool to use to help you. Like I was just talking to one of my patients this morning and I said, as we get older, our vision decreases. Does that mean that we don't need glasses?
Yes.
So as we get older, there are certain things that happen metabolically that can get slowed down, that can increase your risk of insulin resistance. Stress can increase that risk. And then we can have increased cortisol. You know, story time for me, I just went to the doctor and my A1C is 5.9. My A1C is 5.9. So for those of you that don't realize the magnitude of that number, 6.5 would put me in diabetes. And why I'm telling you this story is because stress is a destroyer of your immune system and your body. You see, I am not overweight. However, I do have prediabetes. And because of that prediabetes, it was the chronic stress, which induced insulin, and my cortisol were high. And I just was functioning through it.
Yeah.
And I didn't realize it. So the vital importance of making sure you know your numbers, because you may feel like you're okay. And on the outside, you may not feel like this is an issue for you, but it could be an issue. And when those numbers are in the pre-diabetic realm, some studies are showing that the beta cells within the pancreas that are helping with insulin and making healthy insulin are affected in pre-diabetes. So it's not a place that you want to be. So know your numbers.
And it's one of those things too, just don't take your provider's message of, oh, you're not diabetic.
Oh yeah, so we wait.
Wait for what? I always ask, like, what are we waiting for? For the disease to happen?